menopausal and perimenopausal symptoms. Well, you know, menopause, of course, is that period in life when a woman's menstrual cycles come to an end. And there's a constellation of symptoms that often result. The question is, why does this happen and how does it happen? Well, normally at the end of a menstrual cycle, estrogen and progesterone levels are very low. And there are glands in the brain that pick up that message, and then the pituitary gland in the brain actually sends hormones down through the bloodstream to the ovaries. Those hormones are follicle stimulating hormone and luteinizing hormone. We just call them FSH and LH. Those two hormones tell the immature egg follicles in the ovaries to start ripening and maturing. And then around day 14, one of them will outpace the rest and sort of pop out into the fallopian tube. So that's ovulation, of course. And while it's developing in the ovaries, it's producing estrogen. And while it's rolling down the fallopian tube, that egg follicle is secreting estrogen. And then the part that gets left behind in the ovary after ovulation is known as the corpus luteum, and that secretes progesterone. So in the second part of the menstrual cycle, progesterone levels are higher. Now, if that egg doesn't become fertilized as it's rolling down the fallopian tube, eventually it sort of runs out of steam and it shrivels up and it stops producing estrogen. So estrogen levels fall, and the part in the ovary sort of, shrivels up and dies off. And so progesterone now is not secreted anymore. And so now you're back to very low levels of estrogen and progesterone. The endometrium sloughs off during the menstruation period. And the brain picks up on that signal that it's time to do it again next month, so start the cycle again. So what happens at menopause? Do you run out of egg follicles? Well, you don't run out of egg follicles. There's still about 10,000 of them there around menopause, but these are egg follicles that have had 35 years during a woman's childbearing years to respond to those hormones. They seem to be the least responsive eggs that a woman would have in her body. And so these eggs are not responding to these typical hormonal signals. And so out of frustration, the brain starts to bombard the ovaries with these hormones. There's a huge surge in FSH and LH, and then a spillover effect results in some neurotransmitters being released like adrenaline, and you get this huge constellation of symptoms. So that any combination of symptoms now can result from this huge hormonal imbalance. A huge drop-off in estrogen and progesterone, and a huge surging of FSH, LH, and also some neurotransmitters like adrenaline. So hot flashes, night sweats, fatigue, cravings for sweets and carbohydrates can start up out of nowhere, diminished sex drive, vaginal dryness, irritability, mood swings. Depression can be triggered at this time in a woman's life. Anxiety symptoms, insomnia, restlessness, fuzzy thinking. The brain is not, with neurotransmitter imbalances, it can change your ability to concentrate, and some memory problems can start up. Weight gain can occur more easily, especially, more abdominal obesity. And joint pain and stiffness, irregular periods. Other symptoms, headaches might get worse, a worsening of PMS symptoms during the perimenopausal years, heart palpitations or a racing heart. Your hair might can thin, you get dry skin, your eyes can become a little more dry. Some increased facial hair. Why? Because there's less estrogen, and so relatively now there's more testosterone that might cause that to occur. Urinary dysfunction, digestive problems. So any combination of these things can result. And because estrogen stays down, calcium is leaking out of bones, it's easier for osteoporosis to occur. And you just feel different. So the medical treatments have been to give women estrogen and progesterone, but originally they used synthetic drugs to do that, which were just a bit too powerful for the body, and they ended up increasing risk of breast cancer, stroke, and heart disease. You probably know that. More recently, doctors have started using bioidentical hormones, but I must tell you that we don't know for sure that they're really safer than the original hormones, because no one's been taking them long enough to really know. And I really have concerns about giving estrogen in any form because it causes cells to divide quickly. That's how cancer develops, when cells divide too fast. So I'm not saying it's not a good idea. I'm just saying the first thing would be to use something more natural, that's safe, that's been proven to be highly beneficial for more than 80% of people, for 80% of women going through menopause. So there are some natural herbal agents and dietary modifications that have been shown in clinical studies to be extremely well, and I've seen with my own eyes how effective they can be. So I've explained it all in an ebook that you can download right here for free. It's called The Natural Management of Menopause. It's an ebook that you should really download, because your doctor is not going to know enough about nutrition and herbal medicine and so on because that's not the training that they get in medical school. It's not that they don't think that it might be a good idea. That's just not really where their knowledge base is. So I would suggest that you download my ebook, The Natural Management of Menopause. It's available here. See all the scientific references and use more natural and safe things first and see how you do with it. In 80% of cases, it'll work out well. If it doesn't do the complete job, I would add natural progesterone. I would talk to my doctor about that. Now at machinohealth.com, you'll see my other review papers, other videos that I've made, footage from my live professional seminars, other downloads and resources I created that will help you lead a long, healthy, functional life. And that's what you want. It's not just to be alive, but to be functional. My review articles and teaching materials have all the scientific references to make sure you're getting only evidence-based information on any health topic that you're looking for. So be sure to make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family. Thanks so much for watching.